Hello, I'm Dr. Jordan Harris, LPCS, LMFTS, and I help therapists to get unstuck with stuck clients and to increase retention. And I do this by teaching four core skills. These four foundational skills, if you think of your model as the car, these skills are the gas that make your car run. And these four skills are assessing client motivation, helping therapists to become more persuasive, helping therapists to read client body language, and helping therapists to help clients get in touch with their inner world instead of intellectualizing. Today, we're looking at the skill of motivation in the work of Tori Olds, Dr. Tori Olds. And she works with a woman having a midlife crisis. And just a quick caveat as we get into this. This client is actually, this is from a demo tape that Dr. Tori Olds does with her sister. So this is not an actual client. This is a tape done for training purposes. So, without further ado, let's dive in.
Hi, Annie. It's so nice to meet you. So I know we talked a little over the phone, but I wonder if you could tell me again just a little what you're wanting to work on together, what brought you in.
Okay. Well, I just turned 40.
So I'm going to stop it right there because that's a great example of one of the first skills of motivation. Whenever you're trying to assess a client's level of motivation, the first thing you must have is what they call a target behavior, basically a goal. Now, when I've watched tapes, and I've watched dozens of tapes, no, hundreds of tapes of therapists, all the master therapists ask this question. And it's some version of, what do you want to work on today? Let's watch how Tori does that.
Brought you in. Tell me again just a little what you're wanting to work on together, what brought you in.
What are you wanting to work on together? The way that I ask this question is, if you take a second and touch base with your own heart, what feels like the most important thing for us to work on today? I have a friend of mine, the way he asks this question is he says, what's your highest intention for today? What do you want most for yourself? It doesn't matter how you, I mean, it doesn't matter how you use the words, right? Like there's no magic words. So feel free to find your own way of talking of stating this question. But this is a really important question to start off with clients because it pushes them and it nudges them to really come up with a clear goal. Now, I think sometimes asking clients to come up with a goal feels weird for us as therapists. Part of that is many of us are trained to be client-centered, and I'm all for being client-centered. The flip side of that, though, is sometimes we leave things too open for clients, and then they get lost. And in fact, many times clients come into us looking for direction. Many times clients come in and they're saying, basically, they have the sense of, if I already knew, I would fix myself. So I'm here actually asking for you to give me some sort of guidance. And what this question does is it helps you to actually help them come up with their own goal. So it does this thing of keeping it client centered, but also making it so that clients are really, really having to think through where they, let me say it this way. It keeps it client centered and also directive, right? You're sort of pushing them of, you give me the thing that you want to work on. I can't know. I'm not going to force you to work on something that isn't the right thing for you. But you be very clear and think through what is it that I really, really want to work on. So it's a great way to help the client focus.
Okay. Well, I just turned 40 and life is okay. It's just not great. And I don't know what it is because I have, I wanted kids and I have them. And I honestly feel kind of pathetic even talking about this because there's nothing really wrong in my life. And it's kind of embarrassing. It's almost like feels like how people would make fun of like a midlife crisis or something.
Okay, okay. So I really appreciate your honesty about both of those pieces. So if I'm hearing you, it's like on the one hand, you're noticing, you have already noticed that something doesn't quite feel right. Something about your life or where you are, not fully satisfied, something. Not totally clear about all that part, but you have a sense. And then on the other hand, you've already noticed that you have your sort of inner stance toward that is pretty dismissing.
Yeah, that's true.
Or just embarrassed about it or something,
Yeah,
not
yes.
wanting to okay. So, this second one, this one here, we probably will, at some point work with in our work, it's like getting curious about where does that come from, that wanting to like feel embarrassed about our feelings. So we may take time with that, but just to see as an experiment as we're starting, wonder if you could just ask that to just step aside for a moment. It's like, yeah, maybe these feelings are not valid or not important, but it's kind of hard to judge unless we really listen to them and explore them a little bit.
Okay.
So just see if it's willing to just give a little breathing room for us to be curious about what's bothering you.
Another great micro skill right here. If you watch, Tori asked the question, what is it that you want to work on? And the client doesn't really answer the question. The client gives a sort of vague, meandering sort of answer, while also sort of judging herself, right? And let's watch some of that again. Not the whole thing. Let's watch just a bit of that again.
Is because I have, I wanted kids and I have them, and I honestly feel kind of pathetic even talking about this because there's nothing really wrong in my life. And it's kind of embarrassing. It's almost like feels like how people would make fun of like a midlife crisis or something.
Okay, okay. So
So she doesn't really answer the question. She says things are actually going really well, and then she sort of has some sort of self-judgment. And what Tori does is really skillful. One of the first things you want to do in this sort of situation is sort of sidestep the self-judgment and ask the client, what do they want to work on? Now, why is this important? Many therapists would assume we just dive in, she's already showing us what the problem is. And Tori doesn't acknowledge that. Tori says at some point we'll probably work with this sort of self-judgment. But the reason I think it's a good idea to not dive right into that specifically is because you don't have the client's permission to do that. Until the client has given you, at least at this part of the therapy, you want the client to give you what the goal is, because that's the thing you sort of know they are motivated to work on. The way that I think about this is, imagine if you went to McDonald's and you went up to the front desk and you said, I don't really know what I want to eat. I think I want a burger, but maybe I want a salad, maybe chicken nuggets. And what if the cashier was like, well, what your real problem is that you're ambivalent and you don't know what you want, so you should go into therapy. You would be like, whoa, where's this coming from? Like it just feels so out of left field. And what a good cashier would say is, we actually have a new chicken nugget salad. You can put chicken nuggets on your salad, and it's one of my favorite things. How does that sound to you? Like they're gonna gently push, gently probe for like what is the thing you actually want. And then if you keep getting stuck there, and the client keeps sort of spinning in circles, then yes, you do want to deal with these other parts of her. But the first thing to test out is, can I just ask them to put that to the side and I sort of stick with the question? That's really, really important because if they give you this thing, it's much more likely that they are motivated to work on that. And then you and the client are working together on resolving whatever the issue is. There's a lot more here that we're going to get to in even a second. I do want to just give a quick shout out for if this is interesting to you, if you guys want to do a deep dive on any of these processes, especially motivation, I regularly give trainings on this. So what I would invite you to do is go down to the link and subscribe to my newsletter. That way you'll get all updates about trainings that I give. But also, whenever I release a new video, you'll get the first sort of, ping in your inbox that a new video is out. So if you want to learn more about motivation in my next video, Like you'll be sure to get one of these in your inbox. Okay, let's keep watching Tori.
I really
Um,
appreciate your honesty about both of those pieces. So, if I'm hearing you, it's like on the one hand, you're noticing, you have already noticed that something doesn't quite feel right. Something about your life or where you are, not fully satisfied, something. Not totally clear about all that part, but you have a sense. And then on the other hand, you've already noticed that you have your sort of inner stance toward that is pretty dismissing,
yeah, that's true.
or just embarrassed about it or something,
Yeah.
not wanting
Yes.
to like, okay. So, this second one, this one here, we probably will, at some point work with in our work, it's like getting curious about where does that come from, that wanting to like feel embarrassed about our feelings. So we may take time with that, but just to see as an experiment as we're starting, wonder if you could just ask that to just step aside for a moment. It's like, yeah, maybe these feelings are not valid or not important, but it's kind of hard to judge unless we really listen to them and explore them a little bit.
Okay.
So
Yeah.
just see if it's willing to just give a little breathing room for us to be curious about what's bothering you.
Okay. Yeah.
So take
Do
a
that.
second. All right. So if you are willing, just you said you're turned 40, something doesn't feel like you named the good things. I have kids, but also there's this other thing, a feeling or a sense. So just invite your mind to kind of show you that a little. Just notice, what comes to mind when you think about that.
And what does Tori do here? She brings it back, right, to the most salient thing the client said early on. When you first came in a minute ago, you said that there was this thing that sort of felt, what did she say exactly?
Feeling or a sense. Like you named the good things. I have kids, but also there's this other thing, a feeling or a sense. So just invite your
Right. So she brings it back to this feeling, a sense that things aren't quite right. And then she asks this client just to sort of check in with herself and explore that sense. So at this point, what she's doing is she's basically helping the client to come up with a goal. Like, take the time, go inside, search your heart, and you just give me what the goal is that you feel like is the most important thing for us to work on. It's really beautiful work. It's really beautiful work. And I think it's so, so gentle and kind with a client who's clearly um, distressed and not sure why she's distressed. So look, this is an analysis of how to work with client motivation in the work of Tori Olds, Dr. Tori Olds, and she worked with a woman who's having a midlife crisis. If you want more of this sort of stuff, click the link below and sign up for my newsletter so I can send you more insights and updates when I release new videos. Otherwise, I'll see you in the next video.